Thanks for listening to Wellness Talk Radio. I'm Chris Costello. If you want to find out more about us, you can check out our website at wellnesstalkradio.com. And today our guest is Dr. Michael Ozner. Dr. Michael Ozner is a pioneer in the field of preventative cardiology. He's medical director of wellness and prevention at Baptist Health in South Florida, one of the leading healthcare facilities in America, and medical director of the Cardiovascular Prevention Institute of Southern Florida. He is also the past chairman of the American Heart Association of Miami. Dr. Michael Ozner has written The Great American Heart Hoax and the Miami Mediterranean Diet, Lose Weight and Lower Your Risk of Heart Disease. He is the recipient of the 2008 American Heart Association Humanitarian Award and has been recognized by the Consumer Council of America as one of the top physicians in America. Dr. Ozner, great to have you on Wellness Talk Radio today.
Thank you.
So you've written a great book. You cover all the bases relating to heart disease. I thought I'd like to start there. Can you describe for our listeners, what is heart disease?
Well, heart disease, and in particular coronary heart disease, is the number one killer in the country, both for men and women. Because what we understand is that when people suffer heart attacks, and we should throw in strokes as well, and we put that under the heading of cardiovascular disease. It is from a disease which we call atherosclerosis, which is a buildup of cholesterol. And we used to think that it was simply a cholesterol storage disease, but kind of like we have plumbing pipes in our bodies collecting sludge, and then when the sludge becomes significant, it chokes off the artery and we have a heart attack. That was the old theory. We now understand that this is actually not what happens. We understand that this disease of atherosclerosis, which I liken to the atherosclerotic plaque, to a pimple in the artery wall, is really an active inflammatory disease. And we've learned that over the past decade, and now we understand the mechanism by which these little pimples or atherosclerotic plaques rupture and lead to heart attacks. And really, to everybody's surprise who hears this, it's not the 90% plaque or blockage that you really have to watch out for. It's the 1%, 5%, 10% plaque that suddenly ruptures because it's highly inflamed. And then when blood comes into contact with the plaque itself, we get a sudden and often catastrophic clot that then shuts down blood supply in the artery. So the average person who has a heart attack has no prior warning, just like the average person who drops dead suddenly, what we call sudden cardiac death, has no prior warning because they have a small 10%, for instance, plaque that suddenly ruptures, and when it ruptures, within a matter of seconds, they go from 10% blockage to 100% blockage and fall down. They have a heart attack, sudden cardiac death, sudden vascular catastrophes.
And so how many of these plaques do people that are looking at having heart problems, how many of these do they have normally? Is it just several, or what kind of numbers are you looking at?
Well, that's actually a very good question, because what we have always thought that these plaques were kind of uncommon, and that most people say, well, I don't have a plaque. As it turns out, we know from many different studies that this is a disease that starts in childhood. And there was a study called the Bogalusa Heart Trial, which showed that even children 5, 6, 7 years old had the earliest signs of atherosclerosis, namely fatty streaks. And then as we get into our teenage years and our 20s and beyond, most Americans have these atherosclerotic plaques. And it's from living the good old American lifestyle with our toxic American diet, our lack of exercise, our smoking, our highly stressed society. All of these contribute to buildup of plaque. And as a result, I would say the overwhelming majority of Americans are walking around today with varying degrees of atherosclerotic plaque within their arteries. The reason why some people have a rupture of the plaque and end up dropping dead from a heart attack or having heart attacks, strokes, and other people don't, in large part has to do with how highly inflamed these plaques are.
Okay, so is there hope for people like me that grew up on a very well-rounded diet as a child of kind of like Fruit Loops, Twinkies, top it off with some ice cream? Is there hope for those of us that have switched over and changed their diet?
Well, that's right. I mean, you're defining the typical American diet.
I won't say it wasn't fun.
Well, it's like people ask me. A lot of people think the essential food groups are pizza, ice cream, and hot dogs.
Right.
What we understand is that, and here's the good news, that this is reversible. And the number one killer in this country, cardiovascular disease, is in many respects a preventable disease. And we know the tools of how to prevent it. In my book, The Great American Heart Hoax, I talk about why we've missed the boat, and part 2 of the book is the solution, my 10-step approach on how you can right the ship, on how you could quell the fires of inflammation, how you could have these plaques reverse and actually largely prevent your chances of ending up with a heart attack, with a stroke, with these devastating conditions that take people often in the prime of their lives.